In this video, you will learn about cognitive behavioral therapy, which is one of the absolute best treatments for depression and anxiety. It can also be used to treat PTSD. It can work better than medication in some cases and with longer lasting results. Cognitive behavioral therapy has helped millions of people throughout the world. The resource we offer can be utilized at home without the expense of a therapist. In this video, you will learn what cognitive behavioral therapy is, how it can help you, and about the 3 absolute best at-home resources for learning CBT. Cognitive behavioral therapy, otherwise known as CBT, is one of the absolute best resources out there. It is the original behavioral therapy. It is a clinically tested and scientifically proven treatment that is world-renowned. The American Psychological Association, the National Alliance on Mental Illness, and the National Institute of Health, Care, and Excellence all recommend CBT as a highly effective treatment for depression and anxiety. It is structured and goal-oriented. It teaches the user to analyze their thoughts and change their behaviors to create the life that they want. The core idea is that thoughts, feelings, and behaviors are all interconnected. By changing the way you think, you can change the way you feel and how you act. But it also works the other way too. If a person changes their behaviors, gets off their butt, and starts doing things again, they can physically alter their brain, creating new neural pathways that can better help regulate their emotions. CBT can help you become less reactive to the negative and more responsive to irrational thought. That is why CBT is so helpful in treating depression. The resource we offer is called Cognitive Behavioral Therapy in 7 Weeks, Retrain Your Brain. It is authored by Seth J. Gillihan, PhD. This book will help you understand your thoughts and behaviors and replace the ones that don't serve you with more positive and productive ones. You'll learn real-world common sense strategies to analyze your negative thought patterns and learn how to change your behaviors so you can set goals and better manage your life. Each week's exercises kind of builds on the previous week, and at the end of just 7 weeks, you're done. You will then possess a skill set that you can utilize to stave off depression in the future. Cognitive behavioral therapy in 7 weeks is the absolute best resource for learning CBT skills to fight depression at home without the use of a therapist. CBT can be even better than medication when it comes to social anxiety, phobias, insomnia, because it treats the root cause instead of just managing the symptoms. CBT works for treating anxiety by challenging negative thoughts and beliefs that contribute to your anxiety. Things like overgeneralizing, perfectionism, and thinking everything's a catastrophe. It also teaches the user how to regulate emotions by identifying triggers and teaches coping skills for when things become overwhelming. Aaron T. Beck, MD, the founder of Cognitive Behavioral Therapy, created the absolute best CBT resource for treating anxiety. It is called the Anxiety and Worry Workbook. It teaches CBT skills to treat anxiety and panic attacks. Panic attacks are common for people with unresolved trauma. This book has an entire chapter on how to treat them. It teaches you exactly what to do when panic attacks are coming on so you know the best way to prevent them. You'll be less anxious in general about these things if you're mentally prepared to handle them when they come up. This book is all about taking control of your worried mind and conquering your fears. It'll show you what you do well when dealing with your anxiety and what needs to change. The Anxiety and Worry Workbook gets 4.2 stars on Amazon and can be purchased for just $14. CBT is the go-to resource for treating anxiety and depression. It is a great place to start treating either one. It can also help treat PTSD. The CBT resource we offer for dealing with PTSD is the PTSD Workbook. It was written by Mary Beth William, PhD. It is in its 3rd edition. The new edition features chapters focusing specifically on veterans with PTSD. It has tools for personal survival for soldiers returning from war. It'll teach you how to cope with your trauma instead of avoiding it. It also addresses dissociative amnesia, survivor guilt, grieving, emotional regulation, hypervigilance, unnecessary risk-taking, self-harm, sexual trauma, chronic pain, and flashbacks. So it is for every trauma survivor. The PTSD Workbook gets 4.7 stars on Amazon and can be purchased for just $18. These resources were designed to be used at home without a therapist, but if you're experiencing suicidal ideation, it's time to see one. It won't take long though. CBT can be accomplished in as little as 12 sessions. Don't wait until you feel like treating your illness to get started. You're never going to feel like doing it. In fact, you're probably actively avoiding it. You just have to take action and do it. Now, if you put in time with these books and you're not getting the results that you would like, it may be because you were unable to get to the root cause of your problem. EMDR treats depression, anxiety, and PTSD by addressing the root cause of your emotional pain. With virtual EMDR, it can be self-administered at home without a therapist. Right now, virtual EMDR is offering an extended free trial for military, law enforcement, and first responders. They also have an exciting free offer for anyone who can't afford treatment. Learn more about EMDR and how to claim those special offers by hitting the link here. Help us prevent suicide by sharing these videos. Also, like, subscribe, and comment to help the algorithm show this video to someone who needs it.